and welcome to the next edition of the Academy by Acclivity Health Solutions. Today, we're going to jump right into Value-Based Care 101. So think of this as a survey course you might have taken in your earliest days in college, where we're really going to try to get to a history of the actors that have played a part in creating value-based care, how long they've been at work, trying to define how the models of care need to exist, and what you should know to carry, in your own thinking, the kinds of foundational knowledge that might help you grow in your own journey throughout the rest of the academy, but also throughout your own personal growth. So in our Value-Based Care 101, we'll start with where most innovation in medicine and reimbursement actually happens, is with the largest payer in the United States, which for us is the government payer, Medicare and Medicaid. CMS has been pushing out models by law with the Affordable Care Act, which the press knows as the Obamacare. That act was legislated in 2011, and the beginnings of the ACO world made their way into the real world in 2012. There have been lots of iterations on that model for the past decade. Most recently, there are some REACH models that were created under the Centers for Medicare and Medicaid Innovations, which were funded and created under the Affordable Care Act, again, Obamacare. And there have been about 50 different models sort of pushed out of that organization. So be mindful, innovation happens in healthcare, especially as it relates to how we pay for care through Medicare historically. So there's two things that happens when Medicare starts to innovate. The first thing is they push their own models out. The second is, and where we'll start, is how they delegate the responsibility of care to large commercial Med Advantage players. So the bigger three here that you see are United, Aetna, and Humana, but there are many dozens of organizations that are Med Advantage. And what they end up doing is Medicare delegates the risk to those organizations, who then delegate through a network they create that risk down to providers. In this particular model, they skip the middleman, and Medicare delegates directly to providers. So let's look at what that has been over time as we think first about the column on the Med Advantage side. Med Advantage has been at the wheel of trying to really inform and impact care delivery through reimbursement model and product delivery. This is a Kaiser Family Foundation report on how many enrollees exist over the course of a 20-year period from 1999 to 2020. And you can see it's significant number of millions of persons. This is about a third through 2020 are managed of aged adults by Med Advantage. So it's been growing. And in certain markets, you'll see that the penetration is actually in that 60 to 80% range. We don't have yet folks over 80% of the aged adults are now managed by Med Advantage. But in many markets, you'll see green, which is sort of around 50%, or this amber color, which is around 70% on the middle, and that sort of midline. And you'll see that there are parts of the United States that are significantly penetrated by Med Advantage. Obvious markets like, parts of South Florida, where managed care has been prevalent for a long time. Parts of California, where 30 years, there has been capitated HMO-based, sort of approaches to care. But that's not also unfamiliar in big parts of where big aged adult populations live. So this has been an ongoing approach where, again, Medicare models to push delegated risk down to Med Advantage, who then creates a network and pushes that risk down to the providers in network. What's also true is they typically get involved in early iterations of innovation, like the value-based insurance design models for, let's say, hospice. So this is a double-edged sword. They come in and often use a playbook familiar to primary care, which is create a network and then give discounts off of the traditional fee-for-service methodology. So they're gonna have the opportunity to pull you in network, create more volume for you, but take a smaller amount on each encounter, each episode, or in this case, the daily rate in hospice. That is a playbook that has been run by Med Advantage for a long time. The reality, though, is there's good and bad. That's the bad. You may have a discount. The good is you may be able to take more and more of the premium dollars, the more and more you're interested in taking on more risk. So be mindful, this isn't always a bad thing to see a discount, especially if you're going to own the market under Humana Gold, which is full global risk. I know a certain provider in the Florida market that's been taking Humana Gold risk since 2003, and their growth in revenues are unheard of. In many California markets, they won't take traditional fee for service because there's so much more money to be made in this managed care approach. So it may feel uncomfortable in the early days, but be mindful that this will become a thing that you do because the rewards financially are so great. On the other side of the table is models created directly by Medicare. So obviously we know Medicare Shared Savings, ACO, has been around for over a decade. What's great about the models that we see coming out of Medicare is they're focused on where real patient need is. And the reality of what Medicare consistently recognizes is they have to focus on, one, getting all parties that are under traditional Blue Card Medicare, all beneficiaries, completely under an accountable care relationship by 2030. That is a huge endeavor. And I expect they'll actually make it to that specific endeavor, getting it fully either under Med Advantage risk or through strategic models that get rolled out between now and 2030. Also being aware that the current emphasis is on equity. So if you live in a market where many of the types of persons that live in that market aren't the kinds of persons served by the model, that is going to be punished. You need to serve the persons who live in your communities, and that'll be across the different kinds of equitable ways we look at that population: socioeconomic, racial, cultural, et cetera. So if your market looks a certain way at the sort of geocode, zip code level, your patients need to look that way. So they're going to focus on innovations around equity and innovations around getting all of the aged adults to an accountable care relationship by 2030. Be mindful that this means that there will also be a relaxation or removal of sort of one side only, upside only, where it's just a benefit to you to participate. Think of those as the carrot. Those carrots will be fewer and fewer, and more of what we see happening in the market, as you see here, that more double-sided risk, meaning you have to write checks if you don't meet benchmarks. If you don't meet benchmarks, you'll have to write checks. You'll see more and more of that happening. So more of the population under these models and more of the models themselves requiring you to take up and downside risk. Expect that to continue. Also expect that Med Advantage plans are now acquiring organizations that are in these kinds of models to really scale alignment. So in your market, you may see these brands, these logos, but the owners now are large retail or large health plans themselves, because they can literally move out of the business of getting onesie twosie type enrollments using, advertisement, high paid stars to sort of describe their products. They can move from this onesie twosie type of enrollment that's a very expensive way to get members into the program to acquiring at a lower cost and having larger tranches picked up through acquisition. So the models that we're talking about that Medicare's creating for individual providers to participate in are actually also being pressured through acquisition to roll up to bigger entities who will have more and more control over the kind of products that roll out in the future. So be mindful that what was once a Medicare innovation is going to likely be a market innovation as these acquisition targets continue to be, picked up in merger and acquisition, forces and factors around the market. It's exciting. Obviously, it's a change. If you want to dive deeper in any of these topics, feel free to signal us at info@acclivityhealth.com, and we look forward to seeing you on some future Academy outcomes. Take care.